Welcome to Friday's edition of COVID-19. There has been a tangible drop in daily cases today, but authorities are warning about the presence of variables, including the new strains of the coronavirus and the frigid temperatures here that could trigger yet another outbreak. Some pundits, though, are optimistic amid the scheduled vaccination campaign for next month, and vaccines are what we are poised to discuss later on in the program. But first, I have our Kwon So-ah with the pandemic updates. So, tell us about the fresh decline here in Korea.
Well, excuse me, Sunny. Definitely some positive development this Friday. Korea posted almost 200 fewer COVID-19 cases than yesterday. And with that, Friday's number stands at 674. And that being the result of more than 100,000 tests being conducted every day, including Thursday, despite the shortened hours of operation at temporary screening centers in the metropolitan region on the back of the cold snap. So if you take a look at our graph now, there were only 2 days this year so far when Korea posted over 1,000 COVID-19 infections. So definitely an improvement from the previous weeks. So with that, the average number of daily COVID-19 infections in the past week has dropped to below 800. And also domestic transmissions in average stand now at 765, that is. And just the previous week, we had 976 when it comes to this average. Now, that being said, health officials had some positive developments to announce this Friday, including a decline in movement by citizens across the nation, and that on the back of the country's social distancing campaign. But officials are stressing that until the 17th of this month, which is until when the current social distancing measures are going to remain in effect, everyone has to cooperate to see a clear slowdown of the virus. And also, what's not really improving is the number of fatalities. We have 35 added in the span of a day, and out of almost 1,800 people in quarantine, there are more than 400 people currently in severe or critical condition. But the good thing is that for the 5th straight day here in the capital region, there were no patients who had to wait more than a day to get hospitalized for the virus. If we now move over to our map, we have 258 new cases in Gyeonggi-do province, followed by 191 in the capital Seoul and 30 in Incheon, as well as in Gyeongsang-Buk-do province. And also 41 cases today were categorized as imported cases, with 6 of those detected at the nation's airport or seaports.
I see. And speaking about airports, so I understand we're looking at tougher prevention measures there.
Right, Sunny, and that comes on the heels of concerns regarding the COVID-19 variant from the UK and South Africa. So far, Korea has confirmed 15 such cases. So any foreigners entering Korea by air beginning today must submit negative PCR results. And there will be extra caution regarding arrivals from the nations worst hit by this variant.
Inbound passengers from the UK and South Africa, including both Korean nationals and foreigners, will be quarantined at temporary shelters until they test negative for the virus.
And the measure will also be applied to seaports beginning January 15th. And travel restrictions are being tightened across the world as the variant has been now detected in 22 European countries and more than a dozen other nations around the world. And with that, let's take a look at the global figures. We have the UK at almost 2.9 million cases, adding some 52,000 new infections. That, of course, being affected by the variant there. And also Spain has surpassed the 2 million mark in total infections. And over in South Africa, also surging numbers due to the variant with over 20,000 new infections. And with that, the global tally now stands at almost 88.5 million. And those are the updates I have for now. I'll see you back on Monday. Sunny?
All right, so as always, thank you. Right, staying on the international front, I now have our Kim Sung-yeon here in the studio with more on the COVID-19 situation in our neighboring countries. Welcome, Sung-yeon.
Good afternoon.
Right, now let's start with Japan then. I believe the country there is recording numbers unseen since the start of the pandemic.
Right, Sunny. The situation is very serious in our neighbor Japan, with daily coronavirus infections in Japan hovering at record levels, with around 7,500 new infections being reported just on Thursday. Now, yesterday, the capital, Tokyo, confirmed another record high of roughly 2,500 new cases. Health experts have warned that it will take longer to bring the third wave of infections under control, stressing the need to take more safety precautions. Nonetheless, Yasutoshi Nishimura, Japanese minister who heads the country's COVID-19 response, outlined details on the government's plan to declare a month-long state of emergency for Tokyo and 3 neighboring prefectures. However, the head of a government subcommittee on the pandemic noted Tuesday that 1 month would not be enough time to tackle the latest outbreak.
It will be extremely challenging to improve the situation to the extent where it's possible to lift the state of emergency in less than a month.
Now, meanwhile, the president of Japan Medical Association said in a news conference Wednesday that the emergency declaration should apply to the entire country instead of only Tokyo and the surrounding regions.
The sad reality is, our healthcare system has already collapsed. The government must consider a nationwide expansion of their state of emergency declaration, depending on how the outbreak plays out.
Now, some Japanese health experts fear that even a nationwide state of emergency would be doing too little, too late. An infection control manager at St. Luke's International Hospital in Tokyo said there are already too many cases to keep track of, and that the hospital's intensive care units and general wards were already full.
I see. Song-yeon, I understand there have been new cases over in China as well.
Right, Sunny. China saw the most number of COVID-19 infection cases in 5 months' time. It reporting 53 new infections on Thursday, with Hebei province at the center of the latest outbreak. Now, hence, Chinese authorities are starting to lock down parts of the province that surrounds Beijing, and the measures being implemented are some of the most rigorous since the country's first outbreak last March. Hebei entered, quote, wartime mode on Tuesday, and authorities in Hebei's capital are carrying out mass testing, and gatherings have been banned. According to Feng Zhejiang, a deputy head of the Chinese Center for Disease Control and Prevention, the latest outbreak indicates the virus has been spreading for some period of time, and that the latest strain is not from mainland China, but from abroad.
The latest variant is not from mainland China and is also different from the strains seen in other parts of China. It came from overseas.
At the same time, China has tried to reshape the narrative about when and where the pandemic began, with top officials claiming the virus emerged in multiple regions at once. The head of the World Health Organization on Tuesday said he was very disappointed that China is still barring the entry of a team of international experts tasked with examining the origins of the coronavirus.
Meanwhile, Song-yeon, over in Europe, many countries are imposing, or have imposed, that is, lockdowns.
Right, Sunny, that's certainly the case for many other European countries as well. As we know, a new variant of the virus has been a source of great concern among governments across the European continent. Now, if we start with the United Kingdom, UK Prime Minister Boris Johnson announced a new national lockdown on Monday, and the new restrictions will last for at least 6 weeks. Elsewhere in Europe, Italy's government announced on Tuesday that most of the coronavirus restrictions imposed in the country during the Christmas break would be extended until January 15th. Now, Germany's government also announced Tuesday it will extend the country's national lockdown that has been scheduled to end on January 10th until the end of this month, and will tighten restrictions on movement as well.
What then is the situation over in France like?
Well, one expert did note that the COVID-19 situation in France is relatively better compared to countries like the UK or Germany. But he did add that France is still vulnerable to the new UK variant. Indeed, even if no major outbreak has occurred just yet. The French government's chief scientific advisor on the epidemic said on Wednesday that France is unlikely to avoid the new and more contagious UK variant of the coronavirus, saying saying the country must impose movement restrictions before the new variant hits. Now, Professor Jean-François Delfraisy, who heads the scientific council that advises the French government on the epidemic, said France already had about 22 confirmed cases of the UK variant. And when asked about the need for a third lockdown, he said that the government may have to discuss the issue at around the halfway point of next week, stressing it would depend on the country's vaccination strategy moving forward.
Okay, Sangyeon, as always, thank you very much for that coverage.
Thank you for having me.
Right, COVID-19 has led to a surge in demand for dry ice, and producers believe this demand is poised to grow further. I have Chun Song-cho up next with details. Hello, Song-cho.
Good afternoon, Sunny.
Now, Song-cho, I understand you are at a dry ice factory.
Yes, I'm at a dry ice factory in Hwasong, Gyeonggi-do Province, which is just an hour drive south of Seoul. And lately, dry ice has become a focal point in the news due to its unique ability to keep things very cold in transit. Well, we normally think of dry ice as being used to transport products like frozen food. And in fact, over the past year, during the pandemic, online grocery shopping has dramatically increased, which then led to a dramatic surge in demand for dry ice. But do you know what else needs to have its temperature controlled during shipment? Well, vaccines. Vaccines, they like to be kept very cold, not more so than some candidates of COVID-19, which have to be deep frozen at below -70 degrees Celsius. So dry ice will be crucial in keeping vaccines at the correct temperatures during shipment, and the government is trying to come up with ways to meet in demand to use dry ice to be used for ultra-cold storage and cold chain delivery system of COVID-19 vaccines. And since we're here, why don't we take a look around the manufacturing plant and see how dry ice is made and used. I'll give you some dry ice 101 session right now. So as we all know, dry ice basically is frozen carbon dioxide. They are much colder than regular ice with a surface temperature of 78.5 degrees Celsius. So they can burn your skin similar to frostbite. That's why workers here are all wearing protective gear like insulated safety gloves, helmets, and shoes. So the manufacturing process of dry ice basically starts with the compression and cooling of carbon dioxide gas, which liquefies under pressure. So the liquid is sent to larger tanks for storage, and then until then, dry ice press is used to create the final product. So the press weighs about 180 kilograms. It exerts significant pressure to force the material to turn into a larger block, which kind of resembles like snow over there, right? Then it gets further pressure to be made into bigger blocks like the ones over here. Well, what we know as dry ice. So these containers, these blocks will directly be put into containers that will keep the blocks cold and keep the dry ice from sublimating during shipment to wholesalers, distributors, and businesses. Well, this manufacturing plant in particular has doubled its production to meet the surge in demand ever since COVID-19 started. So I'm going to talk to one of the officials from the company to tell us about how the company's production plans will change once vaccination starts in South Korea. So good afternoon. Welcome to our show.
Good afternoon.
Hi. So some people are worried if we're going to have enough dry ice once vaccines like Pfizer gets commercialized here in South Korea.
Here in FMS Korea, up to 150 tons of dry ice can be produced and distributed on a daily basis. That means for 40 million doses of Pfizer's vaccine, for instance, 160 tons of dry ice will be ready to go for safe transport in 48 hours maximum. So for the matter of this decreasing supply of LCO2 in the future, we are preparing a recovery system to improve production efficiency to 80% for maintaining more quantity of dry ice in stock at all times.
I see. Then what about the company strategies for other vaccines?
All right. Also for other kinds of vaccine transportation, such as Moderna, AstraZeneca, Janssen, we have been prepared with a PCM. It's called phase change materials as an alternative refrigerant produced in various temperature ranges from -70 Celsius degree to +20. So history and experiences have taught us how to keep the best temperatures for food and medical products in Korea, and we are more than confident and proud to provide cold chain service in the name of FMS Korea.
All right, thank you so much for your time to join our show. Thank you. All right, so dry ice is and will continue to be a key factor in maintaining many doses of COVID-19 vaccinations at the required temperatures needed in order for them to be effective. And I really can't wait for that big moment, the day we finally get to see dry ice put into action to be used for shipping frozen vials of vaccines directly from manufacturing plants to your arm. This has been Jeon Sang-cho reporting live from Hwasong, and back to Sunny in the studio.
All right, Sang-cho, thank you very much for that coverage. To our viewers, we do apologize for the disruption in audio connection during that report. Up next, we share with you the progress made thus far on the COVID-19 treatment front here in Korea and the tasks that lie ahead. Now, this follows a local pharmaceutical company's recent application for conditional approval for its antibody therapy. To take a look.
The development of indigenous COVID-19 treatments is gaining steam here in Korea. The Ministry of Food and Drug Safety began its first evaluations of a drug developed by Korean biotech giant Celltrion in late December and vowed to complete the process in under 40 days. The treatment contains neutralizing antibodies that destroy the coronavirus when injected into a patient. In broad terms, there are two types of COVID-19 treatments, with one being antibody treatments and blood plasma treatments being the other.
혈장 치료제는 그래도 헌혈을 받아서 그 혈액을 재료로 해서 만든다라는 점. 항체 치료제는 항체를 이제 합성해서 만드는 것이니까 피를 재료로 하지 않는다는 점. 그래서 이제 만들어낼 수 있는 공급량의 차이가 있죠. 그런 면이 다르고요.
Over the past year, a number of pre-existing drugs have been experimented with to treat COVID-19 patients. This practice, called drug repositioning, proved to be a time-saving and cost-effective strategy. Existing drugs such as the anti-Ebola drug remdesivir and dexamethasone, a type of steroid, have shown limited success in treating COVID-19 patients.
렘디시비르나 덱사메타손 같은 약이 효과는 있다고는 하나 질병을 치료하는 데 있어서 한두 가지 정도에만 듣는 것이지 이게 전적으로 코로나19에 다 듣는 것은 아니고요. 코로나19를 치료하기 위해서는 보다 근본적으로 치료할 수 있는 의약품이 필요한 것이고요. 치료제가 많을수록 다양한 증상을 나타내고 있는 코로나19에 적절하게 대처할 수도 있고 의료진의 선택의 폭도 넓어지는 그런 기대 효과가 있다고 보겠습니다.
Questions have been raised on whether we need a treatment at all, when vaccines are already available in many parts of the world. Some argue that the world will have little use for a treatment when enough people have been vaccinated to achieve herd immunity.
흔히 이야기하는 집단 면역의 수준에 이른다고 하더라도 그건 큰 유행이 발생하는 걸 좀 억제시켜 준다는 것이지 여전히 면역력을 갖고 있지 않은 사람들 사이에 계속 소규모의 유행은 발생할 수가 있고요. 또 바이러스가 지금 계속 변이를 일으키고 있거든요. 그렇다면 그걸 대응할 수 있는 치료제. 그래서 어쨌거나 감염이 되고 중증으로 진행하는 사람들은 계속 있을 것이기 때문에 그런 의미의 치료제도 여전히 의미를 갖고 개발이 되어야 하는 부분입니다.
With vaccines already available and treatment soon to follow, expectations are growing that the pandemic could soon be brought under control. But many challenges still remain.
When you consider any kind of treatment in COVID-19, safety is the most concerned issue. And the other issue is the price. So the only way to prevent the mild to moderate cases progress to a severe disease is to use a certain drug. But if that kind of drug doesn't work, then you have no way, you don't have no reason to use that kind of a very expensive drug.
It is hoped that these new drugs and therapeutics could effectively complement the use of vaccines to free the world from the grips of COVID-19.
In England, people are having the vaccine for the first time, and it will gradually make a huge, huge difference.
To protect the world, we must ensure that all people at risk everywhere, not just in countries who can afford vaccines, are immunized.
To fully fund the COVAX, we have a gap of $5 billion until the end of January, and a global gap of more than 20 billion that needs to be addressed.
Given the presence of COVID-19 vaccines, the world is looking at a fresh opportunity to ensure equitable healthcare access to fight the pandemic. So what is being done to make most of this new opportunity? To answer the question, I have Dr. Yoo Byung-wook from Soonchunhyang University Hospital. Good to see you again, Dr. Yoo. And I also have Professor Chung Hae-ju from Korea University. Welcome to the program, Professor Chung. And joining our talk virtually is Dr. Moon Suri from the Institute, Graduate Institute that is, of International and Development Studies in Geneva. Welcome, Dr. Moon.
Thank you for having me.
Right, Dr. Yoo, let's begin with your assessment of the COVID-19 situation here in Korea first. We're ending the work week with our daily infection numbers at 674, amid cautious claims by health officials that cases may be on a decline. Do you share this outlook?
Well, I hope so. Why I hope so first? Because these days, Korea, we had the big cold in the last 35 years, which means the voluntarily who wanted to the test, but this number of the testers is declined. So as well, so now the detention, Dongbu Detention Center is being also nearly over. So that's why number of the confirmed cases seems like around the 600 to 700, but we can compare from the last week, around the 1,000 number of the confirmed cases. But if we take out the Dongbu Detention Center facilities, its case was 800 since last week. So now decline, but very slowly goes down. So still we are very cold. The coldness is to make all the people are indoor activities more. There are more chance to the close contacts. So which means I hopefully its numbers goes down more quickly. But from tomorrow is we got a weekend. Usually the weekend number of the tests is also 30-40% off than the usual cases. So we have to watching case number till next Wednesday. Usually Wednesday, Thursday, cases of test 100,000 around. So we can tell the next Wednesday if the number is decline, we can say now the peak is gone.
I see. Now, against that backdrop, authorities have also pointed to the new strains of the coronavirus as potential threats to our containment efforts. Dr. Yoo, do you share this concern then?
Well, I have two theses. First, so the variant from the South Africa we found it, they announced this variant September 2020. So already few months before, which means this case or variant can be in the Korean Peninsula already. Another notice from the United States in Florida. Florida, they are confirmed cases, the GR variant from the UK maybe, but they never have been overseas from the US, even though never met any person from the overseas, which means this community infection already spreading. So we do our best to block the airline from UK, and we are asking the PCR certified. But unfortunately, the virus itself, to variants, because virus want to live longer and start to the variant, probably we have already in our communities, just we didn't know that.
I see. Right then, Professor Chong, I'd like to direct your attention now to today's topic about vaccines. How severe is the situation regarding the unequal access to vaccines worldwide?
Okay. So with the COVID-19 pandemic, we have seen that this is not just an, say, health crisis. We saw a lot of social cleavages and social inequality actually emerge in a more complete form in the face of this pandemic. And I am worried that this kind of inequality will also apply to the distribution of vaccines and vaccinations. And so what happens now is that in access to vaccine, we are seeing a concerning development already. So according to Global Health Innovation Center at Duke University, India and EU and the US has secured more than 1 million doses, and the COVAX facility as a total secured 0.7 million doses. And this makes the high-income countries has secured more than 3.9 million doses, while middle and low-income countries has only 1.6 million doses. And so high-income countries, which account for only 14% of the world population, now have 53% of COVID-19 vaccines, which is actually enough for all the citizens to be vaccinated 3 times. And there are several mechanisms that are at work. And so the first thing is that the high-income countries could have invested a large sum of R&D money to the vaccine development, and also they have more money to purchase vaccines. For the middle-income countries, we know that India and Brazil has strong public or private pharmaceutical industry that could have worked as a leverage for the deals they make with the multinational pharmaceutical companies. And some of the other lower-income countries actually developed or provided clinical infrastructures for clinical trials, and that they could use it as a leverage for the vaccine deals. But then other countries is kind of virtually excluded from the purchasing these vaccines. And this kind of makes a concern for the future pandemic. Also, what is related is the cold chain infrastructure to store those vaccines, and also the vaccination tracking systems that is lack in lower income countries. And so that makes huge global inequalities in vaccinations.
Right. Dr. Moon, what are your thoughts on this reality, the rampant vaccine procurement by rich nations, as pointed to by Professor Chung?
I think what we see is that a vaccine is not an ordinary commodity. It's no longer just a health technology, but it's really a strategic asset that all countries are really racing to secure. And this includes high-income countries, but also middle and low-income countries, as the professor just highlighted. And we see that vaccines are important not only to save lives and to stop the spread of this virus, but it's also important, of course, to restart economies. And it's also a resource that's being used to strengthen geopolitical relationships. So we see, for example, that China and Russia are using the vaccines that they're developing and the supply that they have to strengthen some of their geopolitical alliances with different countries around the world. So indeed, it's not purely a health, even just a health policy issue, but it has become a highly politicized issue. And what we've seen is that while a number of middle-income countries have been successful in both producing or securing some access, at the end of the day, it's the richest countries who have been the most successful in getting the largest volume of vaccines per capita.
Right, Dr. Moon, and that vaccine nationalism is looking to threaten efforts to eradicate the pandemic, even as G20 leaders last year agreed that the COVID-19 vaccine should be regarded as a global public good. Could you remind us about the importance of equitable vaccine access to ensure a complete end to this pandemic?
Indeed, I think we've seen a lot of political rhetoric, and it was very encouraging when political leaders first did commit to making vaccines available to everybody. Unfortunately, the reality today is that that's not what we're seeing on the ground. It's not what we've seen pan out over the last few months. And this is important, as I said, indeed for public health reasons to stop the spread of the virus, but it's also important for a number of other reasons. So one of which is, of course, ethical. If we believe that every single person has an equal right to life, and that those who are most vulnerable of becoming severely ill or of dying from this virus should be protected, then we need to get access to vaccines in all countries and not just for those who have the most wealth or power or status in the world. But there are also, I think, at least two other important arguments. One is economic. There was a very important study done by the Rand Corporation estimating that because there is now a mismatch between where the vaccines are and where there is need, the global economy could lose $1.2 trillion per year. And this is because, of course, even if we're protected in one country, in a wealthy country like Switzerland, Switzerland relies very heavily on trade with the rest of the world. You need economies to supply demand in other parts of the world. I think the other key issue not to forget is that this is a very, very political issue. And so if we want to build confidence in international cooperation, to deal with other challenges such as climate change, for example, we cannot have the total breakdown in international cooperation that we've seen in this mad scramble for vaccines. So it's not only a health issue, it's also an ethical, economic, and political issue.
Right. And Professor John, keeping in mind what Dr. Boone has just said, what are your thoughts on the importance of encouraging vaccine equality, so to speak?
Well, it is very important, and I basically agree with what Dr. Moon has already said. Just to add a little bit more of a historical perspective, we have seen the worldwide level access to essential medicines movement at the turn of the century, and that kind of prompt to establish many institutions that is related to equitable access to especially essential medicines, but including vaccines. And as she has said, the vaccines has to be considered as global public good because it has a huge public health and also just generic public importance. Where we are now is that I think it's better than 20 years ago, at least, because 20 years ago we had basically nothing. We had Gavi, but we didn't have Unit 8. Which is a bulk purchasing institution that is established after the United Nations General Assembly in 2001. And we also established the Global Fund to fight AIDS, malaria, and tuberculosis. And many more stakeholders has become more aware of the publicness per se of the medicines procurement. And so that means that we are in a better situation than 20 years ago, but we still have, as we're seeing with the inequitable distribution of the vaccine right now, we still have we still have a lot more to go, per se. Yes.
Right. Dr. Yu, I believe a few countries are opting for Chinese and Russian vaccines given their affordability and relative accessibility at the moment. What can you tell us about the efficacy and safety of these vaccines?
Well, first of all, it's the Russian one. I don't have any idea because they didn't release any data. But the Chinese one, recently we got this new report. They say its efficacy and effectiveness is more than 70%. It's very similar like the AstraZeneca Oxford model one. But we have to think about it. In my personal experience in Latin America, when I work, the cold chain system is not strong enough like US, not even like the Korean Republic now. So they have only one choice because AstraZeneca model, we need just general refrigerator, that's enough. But the Pfizer Moderna one, we need a super refrigerator, less than below 070 Celsius and below 020 Celsius, and the cold chain system should be more strong. So they choose the Russian one and the Chinese one because they're the environmental of the cold chain as well. But efficiency, what more important is safety. Actually, Korea, we have not enough information about the Chinese vaccination, but many Latin America, South America, and Africa countries, they have a trial already done. So they proven about safety. So probably that some country they choose a Chinese one or Russian one because it depends on their country's region.
I see. Dr. Moon, many less privileged countries are hoping to access vaccines through the COVAX facility, a global collaboration that seeks to ensure equitable access to COVID-19 vaccines worldwide. It's coordinated by Gavi, as mentioned by Professor Chong, and the Coalition for Epidemic Preparedness Innovations, as well as the WHO. Has this facility managed to secure sufficient supply, and what are some of the challenges faced by COVAX facility?
Well, I think the creation of COVAX is something that's very encouraging. We have almost every single country that has signed up to support it or participate in one way or another, and I think this is something that's very encouraging. Unfortunately, again, the hard reality is a bit more complicated, and there are many challenges that COVAX faces to actually deliver on its mission. So first is, of course, volume. As we've heard, when wealthier countries have more vaccine than they can use, when they have more vaccine than many other countries, this means that there's just less of the pie available for COVAX and less of the, less volume available to be shared on an equitable basis. The second big challenge is money. We heard just a few minutes ago that there's a gap, a very, very urgent gap of $5 billion, which is really just a drop in the bucket when we think about some of the economic consequences that we're seeing of this pandemic. And in total, the effort to get not only vaccines, but also drugs and diagnostics to all countries in the world needs about almost $30 billion by the end of the year. Again, this sounds like a large amount of money, but I think that we have to keep this in perspective with the devastation that we're seeing. So money is something that is actually relatively easy to put on the table, but it hasn't materialized yet. And then the last thing that is really a challenge right now is that we still don't know when exactly both COVAX, but also many other countries are going to get physical vaccines in their hands, in their factories, into the arms and bodies of people. And we've seen lots of challenges already with production capacity, with slowdowns, with companies not able to deliver the volumes that they thought they could. And so this is a real challenge. And even if we see, encouraging numbers on paper, 700 million, 1.4 billion, 2 billion, the numbers are very uncertain, actually. What that actually means in terms of when countries will see vials of vaccines arriving on their shores remains very, very unclear for the coming year.
Right. Dr. Yu, as you mentioned earlier, there are concerns that securing supplies is simply the first step for many developing countries as their infrastructure looks to challenge the tasks of storage and distribution. What are your thoughts on this?
Well, now we have to move together because COVID-19, if we do push down in the developed countries, but global, or we are all connected. Even the endemic condition of the COVID-19, any time to turn to a pandemic again. So you ever heard about the ODA, so Official Developed Assistance? Because of COVID-19, we are all stopped. G20 and developed countries helping to the developing countries. But because of the COVID-19, now all connection is temporarily stopped. So we have to help for each other for the love for the humanity, but at the same time, we have to help to build up the cold chain for the developed country. At the same time, contribute and donate it for the vaccination together.
Right, collaboration then. Dr. Moon, back in October, India and South Africa asked the WTO members for a temporary waiver on intellectual property rights for COVID-19 related vaccine and treatment efforts for the duration of the pandemic. Now, I understand a consensus has yet to be reached and more discussions will be held early this year. What are the issues of contention there, Dr. Moon?
Well, indeed, this has been one of the most, I would say, politically divisive issues. But as Professor Chung was saying earlier, there's a long history of debates around intellectual property and actually an important precedent that was set that we should be able to take a flexible approach to intellectual property protection in order to address public health crises. And I think there's no disagreement. We're in the middle of, a once-in-a-century public health, worldwide emergency. I think on one side of the debate, there are concerns that incentives for investing in research and development, incentives for innovation will be harmed if countries are allowed to take a more flexible approach to IP. But I think one of the things we have to remember is that much of the research and development investment has been funded by governments, by the public, by taxpayers for COVID. This is not a normal market situation where we're relying on a profitable market to draw in that investment. We've had billions, over $10 billion of government investment now in R&D across all these different technologies. On the other side of the coin are indeed countries like India and South Africa and many, many other developing countries who say, look, we don't want to be sitting passively waiting for supply that might never even reach our shores. So I think it's fully understandable. Every government would, I think, want to be in a position where artificial legal barriers did not block them from manufacturing life-saving technologies. And this is relevant indeed for vaccines, arguably even more so for drugs. We were just talking about the importance of therapies, particularly when countries are not able to access vaccines. Having access to drugs and treatments will be even more important because immunity will not be high enough in a population. And so I think the urgency and the rationale for countries to be able to manufacture without barriers drugs and vaccines is something that is motivating many, many governments around the world right now.
Right. Meanwhile, Professor Chong, the launch of vaccination campaigns has reignited debate over the possible adoption of the so-called immunity passports. Critics point to the moral implications of such an adoption, while advocates claim it's important for the health of the public. What are your thoughts on this matter?
Okay, so, well, immunity passport is issuing a document indicating that you have immunity to COVID-19 and use that document to actually do everything in the society because now you're not contagious anymore. And we know that the WHO has already cautioned against adopting this kind of measures in spring. And there was a comment on the Nature magazine in May last year, which outlined 10 reasons against immunity passport. And that a lot of them has to do with the inequality issues, of course. Some of the things were related to the reliability and the sensitivity of the test, so that we cannot really, how much can we trust the test and we can be sure that that person is immune to COVID-19. But the other thing is that the authors argue that the limited testing capacity will result in differential access to test. So one thing is that can we test everybody at the same time? And if we cannot do that, then there will be people that can be tested later, and that could be people that are relatively more disadvantaged from the society, and that hinders their social activities until they are tested, and that is also related to the access to vaccination too, because. And also, access to vaccination that we're talking about, because, well, there is only two ways that you can gain immunity. So one thing is getting the vaccine, and the other is actually getting infected and recover. And so the first, well, if we have social inequalities in access to vaccines, then we will have social inequalities in immunity to COVID-19, and that will result in social inequality as well. And the second part, like getting infected and being recovered, that of course creates a perverse incentive to get infected, so that doesn't make sense at all. And of course, as you have mentioned, well, I read that there was yellow fever passport a long time ago in the US, and that was basically the same idea. And what we have seen is that, and actually for other policies that are usually universal, people have, how do we say, we have ideas that are against kind of disadvantaged people on average. I mean saying that in general. And so even if it's a universal policy, people who are disadvantaged are likely to be more scrutinized and monitored more closely, which could be a possible threat to the privacy. And so if this results in the inequality in immunity, that could create new social classes that is based on immunity and non-immunity, and also that will relate it to the access to jobs or education or other important social institutions, so it could have grave social consequences, I think.
Right. And keeping these concerns in mind, Doctor, we here in Korea are poised to start our vaccination campaign next month. What should be done to ensure a fair campaign, in your opinion?
Well, we can review about the European history, especially for Germany. The nurse who work in the frontier line against COVID-19, around 25% of the nurses, they refuse to have a vaccination. Why? because the belief of the vaccine, traditionally the European peoples doesn't believe the vaccine too much. So we have one history last October, because COVID chain issue when the seasonal flu vaccination in Korea, kind of miscommunication from the government to the people. So still some or part of the people not vaccinated yet. So from the beginning, U.S. government, they start to educate people who have a vaccination. So Army base in Korea Peninsula, they have an interview last weekend. They say, have been educated and getting information enough first, and then voluntarily have been vaccinated, they feel very relieved, which means shared information and the transparency of the safety and the procedure of the vaccination. We have to start to educate it and share information with the people who are ready to have. So if we can do well, people not register have a vaccination consequently. But if you do just ask the comment to have vaccination, probably some people still remain at home, doesn't want to have a vaccination.
I see. Dr. Moon, a short question, a short response if possible. In your view, what are some of the urgent issues that need to be addressed for as the world hopes to reach herd immunity against COVID-19, given the presence of vaccines? Dr. Moon.
I think the solutions are actually pretty straightforward. What we need is the leadership to actually put them in place. So countries that have more than their fair share should commit publicly to sharing those with countries that have less. Countries that have the means to contribute financially to purchasing vaccines through COVAX, I think, should put that money on the table. And last but not least, we spoke briefly about intellectual property. I think what would be even more important than flexibility in intellectual property is having companies proactively transfer their technologies so that you can have production in factories around the world. And we need companies to really step forward and be willing to do this in a proactive way rather than being forced to, take more flexible approaches to patents. They should really be saying, we are willing to help countries around the world build up their manufacturing capacities so that everybody can get access to vaccines quickly.
Right. Okay, Dr. Moon, thank you very much for your insights. Dr. Yu, thank you for your thoughts here. And Professor Chung, thank you for joining us today. Right, the current cold spell here in Korea is expected to last well into the weekend. Do take care against the chilly conditions and do seek to abide by social distancing guidelines to stem the latest outbreak. Thank you for watching. See you on Monday.